Excellent.
All right.
Very good. Wonderful. So welcome, everyone. My name is Claudia Bornhold. I'm the Dean of the Edwards College of Humanities and Fine Arts. And we are broadcasting on multiple channels to you today. So we have a webinar, and I see people are joining the webinar right now. We're also on Facebook Live. If you get any questions, we will have a recording of this whole discussion on Facebook Live, the Edwards College Facebook page. We will also have a YouTube link that we will share on the page later after we're done here. So I just wanted to welcome everyone to our first panel discussion on what will become a little mini series this fall semester. And I'm really, really delighted that we have such wonderful guests here. This is being hosted by the college, but it's specifically hosted by our Jackson Family Center for Ethics and Values that's housed in the Edwards College. And our Jackson Center is celebrating its 15th anniversary this year. They were founded in 2004, and the Edwards College is celebrating 20 years. Jackson is celebrating 15. So it's a really wonderful, wonderful year for all of us. So I would like to just quickly introduce our speakers and say thank you, a round of thank you for all of them for making themselves available. And then I will hand this over. So our first speaker is Dr. Michael Benson, who is a veteran of higher education administration. He is the third president of Coastal Carolina University, and he began his tenure on January 1st, 2021. He's also a professor of history in this very Edwards College of Humanities and Fine Arts. Dr. Benson previously served as the 13th president of Eastern Kentucky University from 2013 to 2020 and was named president emeritus of EKU in December 2019. While at EKU, he held an appointment as professor of government. Dr. Benson's scholarly work has focused on the development of the research university and its impact on society. He recently completed his third book, titled Gilman at Hopkins, The Birth of the Modern American Research University. It will be released by Johns Hopkins University Press this year, I believe. Wonderful. Our second panelist today is Dr. Annie Andrews, who earned her MD from University of Cincinnati. She completed her residency training in pediatrics at Cincinnati Children's Hospital Medical Center. She was an academic generalist fellow at MUSC from 2009 to 2011, during which time she earned her MSCR. Dr. Andrews' research interests include improving controller medication use among children with asthma, cost-effectiveness analysis, diagnostic laboratory stewardship, and gun violence prevention. Thank you so much for joining us at Coastal tonight. Then we have Briana Martin, who is well known to all of us here on campus. Briana came to Coastal Carolina University from Hainesport, New Jersey, and she is our student body president this year. Briana is a senior majoring in sociology with a concentration in social justice and a pre-law minor. The most meaningful attribute to Briana is having kindness in your heart and extending it to yourself and others. And we know you just like that, Briana. Thank you so much for joining us. And the moderator of our panel today is Dr. Julina Oxley, who is a professor of philosophy and the director of the Jackson Family Center for Ethics and Values. Her research interests are in ethics, feminism, political philosophy, and moral philosophy. She is also interested in the nature of political virtue and social change. She is the author of the book, The Moral Dimensions of Empathy, Limits and Applications in Ethical Theory and Practice. And she edited the book, Experiential Learning in Philosophy, Philosophy Without Walls. In 2017, Dr. Oxley founded the nonprofit organization Grand Strand Action Together. Dr. Oxley received her PhD in philosophy from Tulane University, an MA from Boston College, and a BA from Wheaton College. So thank you all again. Wonderful panel. And I will now hand this over to Dr. Oxley. I will monitor the Facebook a little and be available for questions and answers on that end. And again, thanks everyone for joining us.
Great. Thank you so much, Dr. Bornhold, for that kind introduction for everyone. We'll go ahead and get started this afternoon. It's definitely not an exaggeration to say that the pandemic has changed all of our lives in ways that we've never expected and never knew that could even happen. I've been studying ethics and political philosophy for about 20 to 25 years. And I never imagined that I would need to think about the ethics of living during a pandemic. I've often thought about the ethics of triage in a medical setting. I've thought about the ethics of war. And in an interesting way, it seems like we're living in conditions that are very similar to both of those. So what I'd like to do is just to introduce the panel and the future panels that we're going to be having on and that are going to be entitled Pandemic Ethics. And the goal is for us to think about the nature of right and wrong during a pandemic. A lot of us have ideas about what's good, bad, right, wrong, just, and unjust, but we may never be thinking about how we should act in a pandemic and what our responsibilities to other people are and what our responsibilities to ourselves are. So I'd like to just sort of frame today's discussion in the context of thinking about our social responsibilities in a pandemic and how they sort of interact with, for example, our individual rights. A lot of times you hear the expression, my rights, your rights end where my nose begins. And that seems to be kind of an idea that people have. So what we're going to be doing is sort of exploring what it means for us to have responsibilities to others and how that plays out in a pandemic. So I'll begin by asking my first question to Dr. Benson. This is kind of a big philosophical question, but I'm curious about how you understand our social responsibilities to others, what it means to live in a community when we are in the middle of a pandemic, which makes it hard for us to physically be in community, and what does that social responsibility and our individual responsibilities, what does that mean to you?
Well, first off, thank you very much, Professor Oxley, for the invitation, and to my fellow panelists. It's a privilege and a pleasure to be with you. Dr. Andrews did her medical degree at Cincinnati, and we're very familiar with that medical center, having moved to South Carolina from just 90 miles down the road. So, Dr. Andrews, thank you for being with us. And to Briana, we had lunch just a few days ago together, and we're fortunate to have her enthusiasm and leadership on behalf of the students here at Coastal Carolina. So good to see you too, Briana. Dean Bornhold, thank you for the introduction. And to Dr. Oxley's questions, just a couple of things at the outset. At our Welcome Back convocation just a few days ago, I mentioned to our returning faculty and staff that if you look at the word university, both the prefix and the stem of the word uni from the Latin one, verse to turn to one. So we are certainly a diverse tapestry of people and perspectives and experiences, but we should be in many ways unified toward a mission or a purpose of the discovery, the transmission, the perfection, the application of knowledge, both existing and new knowledge on behalf of society. That's what a university is all about. It's been that really in existence since the 12th century and before then. You go back to ancient Greece, and I'm talking to a philosopher here, so I don't need to go into details. You know what I'm talking about, but the whole concept of university was to bring divergent perspectives together. And in that maybe cacophony of diverse opinions and orientations to be unified in this approach. I mentioned this to our parents during orientation, and it's a phrase that used to be used a lot more prior to some court rulings in the 50s and 60s that in some ways reduced the university's role, but the Latin phrase is in loco parentis. In the absence of parents, institutions, particularly at the time secondary schools, but also universities, had a responsibility to look after students, not to take the place of parents, but to create an environment where those students will be safe physically. I would also say safe in other ways, but not to be inoculated, if you will, from the clash of ideas, because that's what a university is about, but to provide a space where they can be safe physically. So as we approached the start of the new year, and we had this conversation with our board, we were very excited because it was a brand new year with a brand new freshman class that was going to be our largest and best prepared. But this overarching concern of creating an environment where people felt safe physically was so very, very important. It was preeminent. So to your question about the ethics of this, knowing that we couldn't operate outside of what the state had said in the proviso that had been passed by our state legislature, we really had to literally wait until the last second when the Supreme Court ruled that mask mandate was not, universities had the obligation, or excuse me, the responsibility and the right to make decisions relative to their own circumstances. And if I can, I'll read directly from the ruling of the court. We declare the proviso clearly and unambiguously prohibits a state support institution of higher education from discriminating against unvaccinated students, faculty, and staff by requiring them to wear masks, the court wrote. The proviso does not prohibit a universal mask mandate. So the fact that we required everyone to, maybe, Professor Oxley, to your point, to surrender maybe the right not to wear a mask for the public good. We had the opportunity, tool, if you will, in our toolbox to try and keep our campus safe by requiring all people, regardless of their vaccination status, because we're not allowed to ask that, but to wear a mask. And I had a student that wrote me very, very incensed that we were doing this. And I won't reveal his name, but he said, no other state is doing this. You can't do that. We're going to demand our tuition back. And I wrote him back a quote from a favorite president of mine, John Adams, who said this. He said, facts are stubborn things. And whatever may be our wishes, our inclinations, or the dictates of our passion, they cannot alter the state of facts and evidence. So I was not trying to be dismissive. I was trying to be respectful, but I tried to make the point that facts, whether they come out of the CDC or DHEC or medical professionals like Dr. Andrews, are incontrovertible. And in point of fact, it's been shown that masks do, in many ways, retard the transmission of COVID and other illnesses and other viruses. And as a parent of a 10-year-old who's in a middle school where they can't require masks at this point, my wife and I are concerned. Our other two older children are both inoculated, and my two college-age kids are as well. So this is a public health issue that in many ways supersedes anything else that we might maintain in terms of our rights as individuals. And I hope that we can, as it were, surrender some of those rights as dearly as we might hold them, to think there is a public good here. None of us lives in a vacuum, and we have to look out for each other. So that was somewhat meandering, Professor Oxley, but I wanted to cite that case. But also, I just published this, just printed this out because it just came out on the wire about an hour ago. The Supreme Court will now hear the mask mandate oral arguments on August the 31st for public education. So we'll see what happens. They've maintained that this is a public interest and will be expedited. It's gone straight to the Supreme Court. It hasn't gone through other appellate channels. So stay tuned for that, because that may be another kind of watershed moment for our state.
Mm-hmm. Awesome. That's great. Thank you for such a complete answer. I think since you opened up the topic to the effectiveness of masks, Dr. Andrews, would you mind just telling us a little bit about the data? I occasionally see headlines about mask effectiveness. I know there's a lot of people that believe that they're not effective, but it appears from all the scientific journals I've read that they are. And I was wondering if you could maybe just give us some more details and explain why the effectiveness is such an important aspect of why we should be doing it even now, even if you're vaccinated.
Sure. Yeah, I'm happy to. And thanks again for having me. It is actually really refreshing to have this conversation with a different frame of reference with you all. I talk to doctors all day, so this is great. So yes, masks are effective. And the most compelling way I can explain that is we just experienced an entire winter respiratory viral season in our state, with having children with no colds, viruses, flus, because everyone was social distancing and wearing masks. And we saw a dramatic drop in the number of respiratory illnesses, other non-COVID respiratory illnesses that we typically see in children. And since people stopped wearing masks so routinely and went back to their normal lives, we have seen a huge influx of respiratory illnesses in children and adults, including, common cold viruses like RSV, and we're also seeing COVID. So one of the arguments I've heard about masks not being effective is the size of the viral particles and whether or not they can move beyond a mask. And so one of our infectious disease doctors here at MUSC explained it quite plainly that the viral particles travel within respiratory droplets, and respiratory droplets are coming out of my mouth right now. Every time you talk, cough, sneeze, you're emitting respiratory droplets, whether you're healthy or ill. And viruses in millions travel in those respiratory droplets. And so the masks simply act as a physical barrier to the spread of those respiratory droplets that contain the viral particles. So they are the cornerstone of this multi-layered approach of prevention of COVID transmission. And I think it's important to mention that we are living in completely unprecedented times, and we are all struggling with where we are right now in this pandemic because we thought we were on our way out, and then the Delta variant just flipped everything upside down. I myself am struggling with the reality of where we are, and the reality is that we are seeing incredible transmission of the Delta variant of COVID. And as serious as we took this at the beginning, we need to double down our efforts, and really common sense public health interventions like masks, social distancing, and hand hygiene can really help us get out of this.
Yeah, so that thank you for that explanation. One of the things that I read recently, and I don't recall where the school was, but they had not been having any mask, and within 2 weeks they had 1,700 students on quarantine because they had COVID exposure. But then after starting the mask, and after 2 weeks later, the number of COVID cases dropped and the number of people in quarantine went in half. So, I mean, it seems like if we want to maintain face-to-face education, which I do, I'm a social person, and being on Zoom for a year was a real challenge. And so I'd far rather be in person with my students with a mask on than literally not be in the same room with them. So, so one of the things I emphasized to my students on the first day of classes, I said, look, we're in this together. We're in this room. We're talking to each other. What I do affects you. What you do is going to affect me. And I also have an unvaccinated child at home who's ineligible for vaccination. And I said, and if something happens to her, which is most likely it will, because the public schools are not allowing masks, then I'm out. So we need to do our best. And they really appreciated that. And they really got that. And so that kind of leads to, my second question, and that's to Briana. And Briana, what is your sense of the student body right now? Do they have a feeling that we're in this together? And you could either speak on your behalf, or maybe how the student organizations are approaching this. Like, how do you think students feel about being back this semester with respect to COVID and the masking and all that?
Well, honestly, I'm only going to speak for myself because I know there are a lot of people with differing opinions on this campus. And I just want to make sure that when I am speaking, I'm speaking from just my own opinion, because I don't want anyone to misconstrue that I'm speaking for the whole student body, because everyone might not share the same opinions as I do, right? But I honestly think everyone was so excited when we were able to come back on campus, because missing that kind of social effect that being in class has on us is super important. And it was something that was missing in a lot of our lives. The whole reason why we came to college, right? To be in a classroom, learn from our professors, develop relationships with students and professors in our classes. But I do feel like that when the mask mandate, I believed, from my own personal opinion, that it was inevitable, because I keep up with the news. I know about the Delta variant. I'm very aware of what's going on. So I always thought in my mind, eventually we would have to take some safety precautions, especially with so many more students being on campus now with the biggest freshman class. But I do also think that some people, I wouldn't say it's a divide, but I will say there's been some disagreements because there's a lot of politics involved in this now. It's not, hasn't become with students more about like our health, like it's more about like me versus you instead of let's think about the bigger picture. So I feel like that's the reason why we're kind of at a standstill right now between students, because we're not really seeing it as an issue of, okay, well, if we all do it, then we can be in class, like, and we can have everything that we're asking for if we just do this one thing. But that conversation doesn't come down to that. It come down to, oh, well, I want to wear a mask, but you don't want to wear a mask. I'm vaccinated, you're not vaccinated. Well, I'm not getting vaccinated because of this, that, and the third. So it just becomes a continuous argument that I believe, in my personal opinion, doesn't really need to be an argument.
Yeah, I hear what you're saying. I wish I could say that, you know, all the students are like, yeah, we're so happy to be back. We're willing to kind of do anything. So one of the things, let me just announce to everyone who's watching on, well, we have 2 onlines, but for everyone who's in we've got 26 people who are participating on the webinar. And I just want to let you know to please encourage you to use the question and answer function or the chat function to put your questions up. I know we have a raise hand button, but I'm not sure how that works. So why don't you just go ahead and put any questions that you have into the chat. And also, if you're watching on Facebook, please put any questions or comments onto that chat as well. And we're also monitoring those. So it looks like we have a couple of comments. So we do, it looks like we have a surgeon who's watching the live stream, and they're saying that it's hard for them because their numbers are steadily rising in the hospital, and yet we see people outside acting like there's, you know, not a big, you know, nothing happening. There is no pandemic. And so one of the things I'm curious about is I think about the effects of my actions on the people in the medical field, right? Because I've watched them be overburdened, and I've watched them, you know, work all these, you know, super long shifts and try to figure everything out. And it seems like we should even take into account like how our actions affect not just our health, but other people's. So one of the things I was talking about with someone was, well, the cost of the vaccine is free. The cost of going to the hospital is exponential. It could be $10,000, $20,000, $30,000. And plus, on top of that, you're going to be inconveniencing, while making people's lives very, you know, challenging, who are working in the hospitals. And I just today looked at the number of beds that were available in the ICU units here in our local hospitals, and they're in the single digits. There's 1 left, you know, in Myrtle Beach. There's 0 left at the McLeod out in I've forgotten, Inland Horry County. So, you know, we're not guaranteed that we're even going to get a bed if it turns out that, you know, you're going to need intensive care units. So I'm just curious, Dr. Andrews, if you could tell us just a little bit more about how people in the medical profession have been affected. I know lots of us know, you know, doctors and nurses and people who are staff at medical centers. And it seems like if we know that the hospital's full, we should do something.
Yeah, a great question. So I will start by saying, so I'm a pediatrician. I work in the Children's Hospital at MUSC. So I care for hospitalized children from birth to up to really 21. And I've seen more patients with acute COVID this week, these past 4 days, than I did the entire pandemic. So we are seeing just an exponential rise in hospitalized children, some of whom are critically ill. And we are also seeing the same thing on the adult side. And I agree with your assessment that when I walk into work every day and I look at these parents in the face and they're scared, and I look at these poor babies who are sick out, you know, they had nothing to do with this. There was nothing they could have done to protect themselves, and our society failed. And these children are sick. And it is really, really hard to see that and reconcile that then with being out in the community and seeing people that aren't taking that approach, that public health approach, the common good approach. And so what we're dealing with in the hospital has been very difficult. As a pediatrician, the first few waves of the pandemic didn't affect me as much. I took care of some adults in the children's hospital because the adult hospital was full, but we were so fortunate that children went kind of unscathed but now because of the choices that we as a society have made, children are suffering and their families are suffering, and it was all preventable. And it really boils down at this moment, now that we're here, to vaccines for those who are eligible and masks for everyone.
Yeah, it's hard to hear about the kids who are getting COVID because you're, as a parent, you know, the chances are pretty good that that's not going to happen, but then your heart breaks for the people that it does happen to. I've seen in the last 2 days in our county, young parents, men in their 30s who died and left children behind. And that's also, right, a terrible position to be in, not just if your child is sick, but if a parent is sick, and now we have children that are left behind. And I know that this is a phenomenon that's taking place all over the United States, is that there are being children that are left parentless from this disease. So thank you for talking about that. One thing, we have a couple of questions that have come in. One question is about what CCU is going to do further. Are we going to do anything else with respect to testing or any other like vaccination requirements? Dr. Benson, maybe you'd like to elaborate a little bit on our Vax to the Max program. And if you have any numbers or anything to share with us about how that's going, we'd like an update.
Well, thank you. The Vax to the Max program has been very successful. As of yesterday, we were approaching 3,000 students that had uploaded their vaccination records. For the staff and faculty, that number was over 600. So I'll hopefully get some more contemporary data and be able to share that. I like to do it every Monday, so we're approaching the end of the week. With regard to testing, as you know, if you're non-symptomatic, but you still want to double check and be sure, DHEC has set up a Tor Health site over at HTTC. You can go on go2gov right here. That's I don't know if you can see that, but it's all whited out. I'm sorry about the glare, but I did that 10 days ago. I just wanted to double check, and it's free and it's easy. But that's the site just behind the buildings there at HTTC. We don't do any sort of surveillance testing, but for those students that are symptomatic, Student Health Services will conduct a test, or those that have been ID'd as possibly contact tracing. So that's the best avenue, I believe, right now we have in terms of testing. The vaccine mandate, as much as I would love to do it, we're simply not allowed to at this point. And I saw a comment in there that someone wished that we had kind of been a leader as it related to the mask mandate. We strongly recommended to our board, and they supported the mask mandate, or excuse me, the recommendation to wear masks indoors. We were told, and we had, believe me, multiple conversations kind of offline with legislators, with board members, with community leaders, even with our fellow institutions, that USC was the one that first let out, and then the College of Charleston, or it may have been reverse order. Everybody else, from Clemson to Winthrop to Coastal Carolina, we needed to wait and see what the Supreme Court was going to rule, because we were told, we will remember this, and we will, when it comes to budget time, and the budget time is coming at the end of September, because they're going to open up the budget again as it relates to the CARES money and the allocation of those resources, that an additional proviso that may have been even more punitive was a possibility. Now, in the defense of the legislature, they did pass this proviso when it looked like COVID was starting to ebb quite a bit. And I'll never put myself in their place or judge what they choose to do. But still in all, they have the responsibility, I believe, to take into account the public good and the health of all of us. Professor Oxley, like you said, as a parent with an unvaccinated child, I am worried, I am concerned. So we'll wait and see what happens here with the court next week. But I can promise you, Coastal continues to be, I believe, at the forefront in trying to do all we can to protect as many people as possible. The Vax to the Max program is what we're doing now, but if vaccinations or mandating them is a possibility, we will certainly pursue that in the future.
Great, thank you. Thank you for that answer. If I can just ask you to follow up on additional question, I'm curious about, and this is a question that the students had, You know, in some ways, coastal is, I'm not going to say it's a bubble or we have our own laws, but they are, what happens at coastal happens in Horry County, and we can't really ignore what's happening in Horry County. And so I'm curious to know, how are we thinking about community? And when we talk about what coastal's doing, like, are we gonna like change our policies based on, like, so for example, if, you know, COVID just goes wild in the community, are we going to encourage students to, like, you know, I don't know, not go off campus or something? Or like, what is the relationship as you see it between coastal and greater Horry County when it comes to the pandemic? Because it really seems like we have to all work together to at least try to all stay safe.
You're exactly right. And I'd love to hear from Dr. Andrews and from Briana as well. Your point about being, yes, we feel at times like an island, but we're not. And we monitor every day, if not every hour, the rates of vaccination, the cases, the ICU bed occupation, all those occupancy rates are metrics that we pay attention to. The newspaper today took all the zip codes in Horry County and pegged where were the highest vaccination rates. And I think Conway was a little kind of middle of the pack, if not toward the bottom. So you're right, we have to pay attention to our immediate surrounding area, but to the entire county. So I can't divine the future and say we're going to do this or that, but we will continue to monitor. Our website will be reporting data as students have returned. Some of that is now real time, and we'll be able to share that. But the sharing of information with our local DHEC officials, with Conway Medical, which is right around the corner, we pay attention to what Tidelands and McLeod and Ortho SC, you name it. We're trying to work with each other and partner. MUSC, we have a call every Monday with the presidents, and the head of MUSC shares with us the latest information that she can. So I can promise you, we are trying to stay as conversant and participatory with all of our partners here locally.
That's great. Thank you. That was a great, I didn't know these things, so that's great. Dr. Andrews, do you want to tag on to anything there and thinking about community?
Yeah, so just two ways that the choices we make right now can affect our communities. And one is the choices we make to socially distance and wear masks. So every person who's infected with the Delta variant of COVID is expected to infect 5 to 8 people. So that is incredibly infectious. The original COVID strain, that number was 1 to 2. So if you think back at all the parties you didn't go to, all the trips you canceled, all the times you worked from home, there's no way for you to know what infections you didn't transmit because you made those choices. But every day I think about the grandmas on chemotherapy or the young children with immunocompromised, that I may be protected by making smart choices at the beginning of this and smart choices that I continue to make. So you just have to think about that. There is a snowball effect. If you go to a party and you infect someone, that person can infect 5 to 8 people, and each of those people will infect 5 to 8 other people. And the other thing is, you never know when you are going to need your local emergency department, and our hospital systems are stressed to the max right now. And so if you fall and break your leg, you might be waiting for hours and hours and hours because the hospitals are stressed. So the hospitals are part of the community that we all rely on, and we don't know we need them until we need them. But we have to understand that if we are making poor choices and contributing to the snowball effect, these patients are filling up the hospitals, and the hospitals aren't going to be there and ready to accept patients with heart attacks and broken legs and car accidents and all of those things that we can't predict when they are going to happen to us.
Very good. Thank you. Briana, what about you? I'm curious about how students are thinking about their behavior on campus and their behavior off campus.
I think it honestly comes to just your level of discipline and self-sacrifice, right? If you're not willing, you're not going to do it. You have to decide and make a choice, because we're in college now, we're all adults, right? You have to make that active choice that this is something that you want to do. Nobody is holding your hand. Nobody's going to force you to do it. Nobody is going to be telling you, oh, don't go to this party, oh, don't go here, oh, don't do that. You have to decide what is more important to you. And if that is more important to you, that's the decision you're going to make. And I even myself I've had to make a lot of self-sacrifices. Like, I just turned 21. Like, of course I want to go out. Of course I want to go to the bar. Like, of course I want to have fun, right? But that's not an ideal choice for me to make, because I'm thinking about not just myself, about the other people around me. And I'm noticing a lot, like even with my friends, like instead of going to a party, like we'll go watch a movie together, like 4 of us, and like we're all vaccinated. So just making sure that you, first of all, you know who you're hanging around, like, and if you're uncomfortable or someone around you is going out, like make that known. Like, you also have to be a self advocate. Like, if you're uncomfortable with someone's behavior, you don't want to be around them, you need to say that, because you have to take care of yourself also in the midst of this whole pandemic.
Yeah, I think you make a great point, Briana, about knowing who you're hanging around with, right? We usually don't make a lot of these choices in a vacuum, and we don't usually have to ask a whole lot of questions about other people and their health status. But at this point, we don't know, right, how our actions can affect others. So we have to think carefully about, who we're hanging around with, so that we can limit our exposure. So one of the things I don't know if this is I have a couple of questions just about wearing masks and vaccines and things like that. So one of the questions that has come up with students is they've asked, look, I did the right thing. I got vaccinated. How come, you can't put all the vaccinated people together and then put the unvaccinated people together and then they can wear the mask? But it seems like with the Delta variant, it's not quite that simple anymore. So I don't know, Dr. Andrews, can you just say a little bit? You've already said some about how the Delta variant is different from the initial COVID-19 virus, which started initially 1.5 years ago. But can you just say a little bit about how these things change over time, because it's going to continue changing, right?
Right. And so it will continue to change, and we'll start to see more strains the longer it takes us to get to herd immunity. And herd immunity is when 80 to 90% of our community is immune to COVID. And you can get immunity 2 ways. One is the vaccine, and the other is by getting COVID. And I obviously highly recommend the vaccine. So because we're seeing new strains, we are very fortunate right now that our current vaccines are very effective against the Delta variant. But I have heard many people much smarter than me say recently that the longer it takes us to reach herd immunity, the better the chances we will come upon a new strain that the vaccines are not as effective against. So public health prevention measures, it's multi-layered, it's vaccines and it's masks. So when you wear a mask, even if you're vaccinated, I wear a mask obviously at work all day. I wear a mask to protect, because I could still get infected and be asymptomatic and shed the virus to those people around me. So we know that vaccinated people can still shed the virus if they become infected. They may have an asymptomatic infection, but they can shed the virus. So, I mean, again, this is an unprecedented situation, and we just have to take all of the precautions we can to protect those people around us and to protect ourselves. So even if you are vaccinated, especially if you're in a classroom setting with many other people, it is critically important that you continue to wear your mask to protect everyone, including yourself.
Okay, great. Thank you. So thinking about this question. So one of the things I've got a lot of questions, so I'm just going to kind of pick and choose from them. There's one question about vaccination status that has come up a couple of times. So some students have said, should we even allow people who are not vaccinated to be like on campus? Should that be something that we allow? There are a lot of universities who are requiring vaccines, unless you have a medical reason. So, or maybe a religious exemption. So either maybe Dr. Benson, do you want to speak to that, to sort of thinking about campus and students, and then maybe exceptions that we might have for vaccines going forward?
Well, first off, there are allowances, there are exceptions that can be made for religious or other medical reasons. Some people that may be on a medication that we're not quite sure what the adverse reactions might be to the vaccine. So those and students that have made those appeals or have made those applications are considered, and I I'm sure they're granted. So please know that we will make allowances for those medical conditions or other kind of considerations. That said, if you look around, and I pay attention every morning to these emails that we get with kind of the latest on the wire, in Louisiana just the other day, or as they say there, Louisiana, announced that at LSU for football games, they are going to require either your vaccination card or proof of a negative test. So public institutions, you've noticed this, in the Chronicle of Higher Ed publishes it every morning, kind of the vaccine status of those institutions, those places where either a mask mandate, which has happened just about every place, or a vaccine mandate has taken place. A lot of those institutions are private, but some of the public ones are now trying to be even more aggressive, again, based on the argument that this is a public health issue. So when I said before we would consider that, I saw it in the chat that they were asking if that would be something we would mandate. I will say this: we will consider everything, and if our overarching goal, two things, the health and safety and well-being of everybody on campus and our community, to your point, Professor Oxley, and number two, doing all we can to deliver on the promise that we made to students, that we were going to do everything to be face-to-face. And Professor Andrews, or Dr. Andrews, pointed out that that means being in that classroom, and you, regardless of your vaccination status, which we, by the way, cannot ask. We can't ascertain whether a person is by asking them. But wearing that mask, being cognizant, being always mindful of how we're comporting ourselves, not just because of stuff we want to do, but taking into account the needs and the well-being of other people. So we will look at everything, and we're doing this on a daily basis. And I can promise you, after I'm done with this call, we have kind of our end of day update as to where we are, and we will continue to monitor and update as required.
Great. That sounds good. I like the idea of a fully vaccinated football stadium. I'd go there.
Well, I mean, if they can do it at Death Valley in LSU, my word, they can do it anywhere. So well, stay tuned. So we'll see what happens.
Yeah. I mean, I think it's wonderful how sports can be a leader on something like this. So doesn't always make, and the musicians are doing it too. You know, I know Dave Matthews Band and Fish are also requiring their concert goers to be vaccinated or submit proof of vaccination or a negative COVID test. So, you know, it's an opportunity for people who have a platform to use that platform, as you're saying, for the common good. So let me see. So I want to talk about one thing that's a little bit of a challenge right now is reporting COVID cases. And I have some students that were concerned about the self-report, because most people do not want to self-report. They just want to fly out under the radar. So Briana, I'm curious as to your opinion about reporting and how important that is for students to do. And I know that we have a new system at Coastal where students can get telehealth for free. I think it's like 24 hours a day. And so I know that some people are choosing that, but other people still might choose to go to a doctor off campus as well if they're feeling sick. So, so do you have some recommendations or ideas? Briana, why don't you maybe talk about that first, about reporting and the role among students?
So we just recently implemented something called like contact tracing in our classroom. So you should know the person sitting in front of you, sitting next to you, sitting behind you, their first and last name. So if they report or they reported that they have COVID, you're made aware and see if you need to quarantine. Even in one of my classes, like today, we just found out that like 16 more of my professor students are in quarantine now. So like this is a very real, very active situation that is happening, especially in our daily classrooms. And just in my own personal opinion with self-reporting, I know sometimes it's difficult because you feel like you're telling on yourself, like, oh, I don't want to say I got COVID, like, because people are going to think I'm irresponsible or, you know, that I'm doing something wrong. And even though that may not be the case, it's just you have to make a decision that like, it's important for the people around you in your class to know if you're sick or not. So like, even if you're sick and you don't want to do it, think about that person next to you. You don't know if they're immunocompromised or not. You don't know if they don't live on campus. You don't know if they live with a family member that may be sick. You have absolutely no idea. So like it has to come from outside yourself. Like maybe if you don't want to, you're scared, that may be fine, but think about the other people around you. Like they're also important, and like their health also matters. So even though you may be kind of wary about it, I think sometimes you just gotta bite the bullet with that and just say like, I'm just gonna do it. Like whatever you still have class, you can still go to class, you can still have online, you can still get your homework assignments. Like it doesn't prevent you from doing any work. It may prevent you from, hanging out with your friends, but like once you get better, you can do that again. So it's just like, you just have to make the decision that reporting is and I'm kind of learning, like seeing more reports than normal, that people are taking this seriously. Like if they do get sick, they are telling their professors, they are going to student health services, which is also a great place to go. If you do not have the money to go off of campus, they're available to all students. So I'm learning that students are actually taking this very seriously when it comes to reporting. Whether they don't really want to or not, they're still doing it because they understand that it's imperative for their professors and the other people in their classes as well.
That's great. That's great.
Professor Oxley, could I just add to what Briana said? I really appreciated her point about professors being understanding. Before we got on the call, I was visiting with Dan Ennis, our provost, and we had heard reports that some faculty weren't completely conversant with the policy relative to excused absences for quarantine for the contact tracing. So part of that's probably our responsibility, that maybe we haven't communicated as repeatedly as we should, but we'll get that out again so everybody is conversant with our policies, our protocols in place to ensure that if students do report a case, if there's contact tracing involved, the allowances are made for their absence for class, because that is paramount.
Good. I'm glad you clarified that, because somebody asked me that the other day and I was like, well, I mean, we have an absence policy, but we'll record the classes so that people can, we don't want to punish you, right, for being honest. So we're going to do the best that we can to work together so that, you can do all your coursework while you're, still at home. So yeah, I'm glad you clarified that for everybody. Dr. Andrews, do you want to jump in on that?
Only to say that, that the contact tracing is really one of the cornerstones of how we can mitigate the spread of this virus. And so without that, and without people making their own personal responsible decisions, this is all going to fall apart, and it's going to continue to snowball, like I was saying. And so I think, yes, being a student at an institution that supports people to come forward and say when they aren't feeling well, and to support them to continue their learning from their dorm room or from home, is really, really important. And so I commend you for doing that. And I hope that students feel comfortable, saying when they're sick and saying when they're positive, because without that, we're not going to ever get anywhere with this.
Yeah. Go ahead.
I really appreciate what Dr. Andrews said. And if I could just reiterate too, Monday, the FDA approved the Pfizer, I almost said Pfizer, it's Johnson & Johnson. The Pfizer vaccine, the Johnson & Johnson, as you know, is a one-shot. But I use this quote from Jonas Salk, who helped develop the polio vaccine back in the 50s, when there was some concern if the polio vaccine was safe. Nobody knew what the side effects were of that medication would be. And his response was, it is safe, and nothing is safer than safe. And masks work, yes, but the best way to protect yourself, and Dr. Andrews can back me up on this, is to get yourself vaccinated. The collateral impact that it has, not only on you, but all those around you, in terms of protecting and inoculating yourself and those around you with whom you come in contact, is so important. So I know Dr. Andrews she's nodding her head in agreement. I didn't come up with, all this longitudinal data that's out there now is saying this is the best way to protect yourself, is to get the vaccine.
Yes, absolutely. And I think one of the most telling things is the healthcare workforce, like 98% of doctors, at least, are vaccinated. And my husband works here also. We're first in line to be vaccinated. When it's approved for children under the age of 12, I will sleep overnight in line if I have to get my children vaccinated. That's how much I believe in this vaccine. And I'm worried about my children being in maskless classrooms right now. I heard, actually speaking of LSU, a physician there describe, because people are concerned that this vaccine technology is new, but it's been developed over decades, these mRNA vaccines, and scientists knew that something like this was going to happen someday. And so they worked to perfect this mRNA vaccine technology. And we are all really lucky that it was ready to go when this pandemic hit. And so all they had to do was isolate the virus, understand the virus, and then develop the vaccine with the technology that they had been studying for decades. So it is incredibly safe. It is much safer than getting a COVID infection. I've really scratched my head when I see all these news stories of people lining up to get infusions of the remdesivir antibodies, because what a vaccine does is it allows your body to produce your own antibodies if you are exposed to the virus. So why would you rather get someone else's antibodies when you can get a vaccine? So your body, someone described it as a homeopathic version of the monoclonal antibody infusion. And that's what it is. And that's what a vaccine is, so that your body can robustly produce antibodies when you are exposed to the virus. So it really is our way out of this. And I believe very strongly in the effectiveness and safety of the vaccines.
Great. Thank you for clarifying that. So I just have a couple of other questions about vaccines that have popped up. One is about getting the third vaccine. We know that that's an option for people who are immunocompromised. And then we have a student who's asking, and we know that we have other policies regarding vaccines on campus. And so why can't we just require everybody we already require them to get, the Tdap and things like that before they come to campus. So why can't we have this other one? So maybe just talk for just another second about the future of vaccines in terms of like the third one. And are we looking at a future where we're probably going to be needing to take a booster shot every 6 months? Or we don't know these things, I guess, but nobody can predict how we're going to get out of this. But if you have anything to add about that.
Yeah, so the booster for people who already qualify for the booster, who are immunocompromised or immunosuppressed from a disease or a medication, absolutely. You should follow those recommendations and get a booster. And what I'm hearing is that they are going to expand the recommendations for the booster, and soon many more people will be eligible and recommended to get a booster. And again, I'll be first in line to do that when it's my turn. But I have also heard that folks think that third dose, that booster, will provide longer term immunity. And so that we really don't know, like you said, is this going to be just like our annual flu shot that we get? We don't know for sure, but I am hearing some people saying that maybe not. Maybe this third dose will provide really pretty long-term immunity to the COVID infections. And your point about other vaccine recommendations to go to college, to go to kindergarten, something we've all accepted as part of being a part of a society for a long time. It really is frustrating to see it become so politicized, because it's different because this is a new vaccine and it only recently got the full approval. So I understand why it's not mandated at some institutions, but we need to think back. We showed our vaccine papers to go to kindergarten and to go to summer camp and to enroll in college. So this is not a new concept, and this mistrust in medicine is something that my profession is grappling with, and it's been very difficult these past 18 months to see the trust erode. And I hope that we can earn back the trust. But yeah, vaccines have been a thing for a long time that we have accepted as a necessary part of being a part of a functioning society.
If I could just piggyback on that, I really appreciate what Dr. Andrews said. I've been here since January. I contracted COVID the latter part of the month, got my shots when I was eligible, but my wife and children didn't arrive until July once they finished school in Kentucky. They wanted to enroll here, matriculate at the schools here in Myrtle Beach, and couldn't do that until their immunization records had been sent. So they couldn't even enroll for classes until they showed all the ones that had been around forever. Now, part of that is the newness of it, and whatever people argument they might make about there's not enough data, still in all, it's safe, it's effective, get it. And there may be a day in the not so distant future, Professor Oxley, where we can mandate this. That is one of those immunizations, that record that will be added to your long-standing record. So we'll have to wait and see what happens.
Yeah, for sure. I just want to mention that we do have a comment in the chat from someone from Conway Medical Center who's saying that they are offering the booster shot as long as you have reached 8 months since your second dose. So if anybody's watching and is interested in getting that, they're doing them at Conway Medical Center. So I thought I'd share that. Briana, do you have a comment?
Yeah, I just wanted to say that we always are talking about like vaccinations. I know I had to get a bunch to go to any form of school. But I will say that just something to keep in mind that all vaccines started somewhere. So like this also has to start somewhere. So obviously way back when all the vaccines were getting started and people were making them, scientists were, mixing up the vaccines, people did not want to take them also. So there was a time in the United States where people didn't want to wear a seatbelt, but everybody wears ones now. So you just have to put things into perspective sometimes like that. It just makes it easier to understand and just kind of explains in layman's terms that, we got to start at somewhere and somebody has to start taking the vaccine. And that's why we started taking the vaccine. And then hopefully as time goes on, it'll be just like something else, just like the flu vaccine, just like, we have to get tuberculosis shots and we got to be HPV. There's a whole bunch of vaccines we have to get, but we get them and nobody complains about those. So like, you just got to think like, okay, well, eventually nobody's going to be complaining about this either, because we got to start at some point of disagreement or agreement. So that's just something to keep in mind, as we move forward, that it's not all bad. And even if you don't want to, if you're so many reservations to get in right now, at least just wear your mask. If you're not comfortable, which I can obviously understand, just do a little bit of your part and just wear your mask if that's not what you want to do.
Yeah, no, you're absolutely right. Change is hard. Especially when you're undergoing change so quickly. It's life is all about being adaptable. I think that's probably one of the things I've learned now that I'm in middle age is, learning how to adapt and it's not easy, right? When you're yourself for your whole life, and then you're like, wait, I know I have to do things differently. So I just have one question that I want to close with. We're reaching sort of the final 5 minutes or so of our chat here. And I teach ethics. And one of the questions that comes up a lot is, who decides this stuff? Who decides right and wrong? Who decides, how we should be living in society? And, philosophers have many, many answers to this question. Plato thought, we should have philosopher kings. I think that's a great idea. I'd love to be a philosopher queen, get my little crown on and go start, making decrees. I'm just kidding. I have no interest in being a queen, but how do we decide? And the answer that I come back to is we decide together. I can't dictate how the world is. The president of the United States can't dictate how the world is. The president of Coastal can't dictate how the world is. And the more that we try to exercise our individual freedoms to try to achieve what, our own individual good, we're just going to start running up on each other. And tyranny is not the way out, right? We're not going to have somebody who comes on with, the 10 commandments to tell us all how it's going to be. And we have to work together. And one of the things, Briana, that I've been thinking about is, what role do students want to play in the pandemic? And what role do they want to have on campus? I know that sometimes students feel disempowered about things. They feel like they're not getting to decide things. But, in these circumstances, even I'm not making the decisions, right? We're deferring to experts who have spent their lifetime studying these things. And, I'm curious, like what role do you see for students? There's 10,000 students at Coastal. There are not that many faculty members. I think there's maybe 500 or 600 of us. So we know that the student body is who we're here for you, right? We're not here just for our own edification. We're here to shine a light into, the hearts and minds of the students who are sitting in front of us. And so what do you feel like students, the role that students want to play in these days?
I honestly, I kind of believe in this capacity is the time to kind of call on our student leaders like myself. We obviously, all student leaders are part of a host of different organizations, Greek life, clubs, and they all have a say in those things, right? And I think this is the time where you have to decide whether you want to, align. If this is not your choice, you don't have to do anything. Nobody is forcing you to do anything. But it's a time as a student leader, you just have to think to yourself, like, that kind of sense of nationalism that we all have, growing up in America. That's something that, everybody, you got to support, you got to support this, you got to support that. And sometimes you can lose yourself in that. But I also think as a student leader, we have our own opinions. We're also very independent, and we're in college to grow. And at this point in time, of course, every single student is not going to want to take action. But our student leaders, I would like, if you're watching, to petition you to take action yourself. It's very easy to have a conversation with your club or your organization, and just talk to them about what you would like to see them. Charge them to make different actions going forward. Everything is changed by word of mouth. I will say that it's the most powerful tool, especially on this campus that we have. It's very big, but stuff travels quickly. So the best thing that I could say to do is definitely having that conversation with your peers, as a student leader, having that conversations with the people that you lead, like you want to all be aligned in one group and all be central and have the same ideas. And even if you have differing ideas, just explain it as a situation where it's not really about your personal, it's kind of about the betterment of the school and the betterment of the people around you. So even if it may be a hard conversation to have because of all the, politics surrounding it, obviously, everyone has their own political views, but sometimes you have to step outside the box of partisanship and kind of looking at lens of basically public health. So what is more important, your political side or the health of the others around you? So you just kind of have to decide to make that choice. So I think that's what my advice and what my, saying would be to students watching, to make sure that that's something that you think about going forward.
Great. Thank you, Briana. Now we see why you're the student body president. You're such an inspiration. Let's see, Dr. Andrews, do you have any closing remarks that you'd like to make?
Sure. I'll just say back to the point that was made at the very beginning by Briana about kindness and thinking about the people who are more vulnerable than yourself. And right now that includes, children in our communities, and that includes elderly, chronically ill people, and your choices that you're making right now are affecting them. And so think about that. And then also, if you have questions about the vaccine and masks, go to the people in your life that you've gone to for medical questions in the past, your trusted family practice doctor back home or the campus physician. I mean, you have turned to those people anytime you've had a stomach bug or needed stitches or sprained your ankle, and this is no different. So please just go back to those folks that you have trusted to make medical decisions for you in the past and listen to what they have to say about vaccines and masks and how to protect yourself.
Great. That's wonderful. Thank you. President Benson, I'd like to leave the final closing remarks to you.
Well, I'm not sure I can add much more to what Briana and Dr. Andrews has said so beautifully and so eloquently, other than I'll kind of harken back to what my mother used to teach her 6 kids, and this kind of lesson that was constantly tried to inculcate in the entire family, and that is, treat others the way you want to be treated. And regardless of your ethical orientation or your religious background, that's your business. But life is about, yes, looking after yourself, trying to comport yourself in a respectful way, but being concerned about others. And, you talk about our carbon footprint and trying to reduce that. Think about also your physical footprint and the mental footprint that you leave and all the other footprints. They can be positive and they can be negative. So what are we doing on a daily basis to be an example, but also to show our concern for those people around us? This is a relatively small world with a lot of people on it. And we're all here, I believe, to do our best and to look out for each other. So if we've learned anything from this pandemic, I think it's been that none of us lives in a bubble or a vacuum. Our actions have consequences. And I'm really happy to be at a university on a campus that focuses on these kinds of conversations. So Professor Oxley, I thank you very much for organizing this, and to my fellow panelists, really enjoyed your comments. And to all you Chanticleers out there, keep on doing what I hope you're doing. I've got multiple masks here. I keep them with me at all times. So mask up, get vaccinated, and go Chants. Thank you so much.
Thank you. Thank you so much, Dr. Benson. Thank you to everyone who's been watching the panel this evening. We've had a lot of participation, a lot of discussion. And I'll just quote Dr. Claudia McCullough, who's the founder of the Jackson Family Center for Ethics. She would end all of our events when she first started the center by saying, go talk to somebody about something you heard here tonight. What our job is to do is to stimulate conversation about ethics. So for everybody who's heard this tonight, please go and just have a conversation with anyone about something you heard here tonight. That's what ethics is about, is talking about our ideas with other people. So please share what you've heard here tonight with others. And we look forward to having more events in the future here. This is the Jackson Family Center for Ethics. I'm Dr. Jelena Oxley, and I am signing off for our event tonight. So thank you everyone for participating. And thank you especially Dr. Bornholt for helping to host this tonight. And our tech person here, Mr. Michael DeGiorgio, who's been our wonderful help here tonight. All right. So thanks, everybody. Have a good night. All right.
Thank you.
Thank you.
Bye.